Hi, and welcome to Kent County Closeup. I'm Deb Havens. As far back as 1989, a national commission warned that for the first time in the history of this country, young people are less healthy and less prepared to take their places in society than were their parents. My guests today say that situation won't improve unless families are part of the solution, and the Kent School Services Network, or KSSN, works in public schools to serve the community as well as our kids. So my guests today are Carol Paine-McGovern, the KSSN Executive Director, Earnestine Mays, the KSSN Community School Coordinator, and Lorraine Young, Pathways to Potential, the Michigan DHHS Success Coach. So a lot of titles there, but welcome to all of you, and we'll get into how each of your positions really work with families and kids for improvement. So Carol, let me start with you. I understand that the Kent School Network Community School is a strategy. It actually is centered on public schools as a community hub, and that people can go to their school for, well, it's not just the kids that go to the school, it's entire families for integrated health services, social support, and it engages the whole family. So let's begin with, is the strategy a result of the fact that kids are having a tougher time now than they used to in the past?
Well, I think about 14, 15 years ago in the community, leaders were looking at how could we best support all students. And one of the things they decided to land on is, what about if we took a systems approach and brought services to students where they are in the schools, families there, creating this hub of support. And part of the role of a community school is a place and a set of partnerships. So by centering services within a school, you're also bringing in community partners to help deliver those services and support the school. And really that old, phrase of it takes a village, you do become that village, and you're wrapping your arms around the students in the school and then their families as well.
Okay, well it sounds like it makes a lot of sense, but let's delve into how it actually works. So Earnestine, first of all, how do you actually work with parents as well as children to improve their performance in the school?
So what we do, Deb, first of all, I want to say thank you for having us. I'm very passionate about Kent School Services Network and the work that we do at Campus Elementary School and for Grand Rapids Public School. What we do is we address what the needs of the students are. We service the students and parents definitely by what are the needs of the parents, what are the needs of the students, and as you have said and as Carol has said too, we utilize the school as a hub to provide those resources based on the need of the students and the families. And it's about having nurturing partnerships, making sure that partners are there to make that need, take care of that need for our students as well. So basically having the resources, surrounding the resources around our family, and getting to know the family and the students and what they need in order for them to be successful in school.
So what I hear you saying is that this is a much bigger challenge than just teaching a child the ABCs, let's say.
Yes,
that child is not going to learn very well or to optimum without the family support.
That's very true, and that's one of the things that as the community school coordinator at Campus Elementary School is something that I drive home to not only the stakeholders of campus, partners I should say, and also the students and families and also the teaching staff. So we really use the community school, the CAS developmental triangle to make sure that children needs are met on all sides. That's the core instructional program, that's the education and cultural enrichment program, and services to remove barriers to learning. So that's why we are there too, to make sure that those entities are connected together in order to support the students in their learning and move more toward academic achievement.
Okay, I'm going to ask you for an example of that in just a moment.
Okay.
But first I want to go to Lorraine.
Okay.
Lorraine, you're called a success coach.
Yes, I am.
And this sounds like another innovative approach. And it's part of a program, it's a statewide program, I understand, called
is.
Pathways to Potential.
Correct. That's
Okay,
correct,
share a little bit about that. How does that work?
Once again, Deb, we thank you for inviting us.
Oh,
It's a
you're
pleasure
so
to
welcome.
be here. And as you mentioned, Pathways to Potential is an innovation with the Michigan Department of Health and Human Services. The Pathway program initially began in Detroit, Flint, Pontiac, and Saginaw. And now, excuse me, I'm gonna start over, okay? Because I get so excited, and I just,
I
know
love
that
it.
so
I love
many
it.
families are experiencing this great experience within the schools. And it was designed because human services were placed in the schools to meet parents where they're at, to provide those services for all of the students. And excuse me, I'm going to start over again. I'm so
Lorraine,
sorry.
you are too funny.
I know, but I'm thinking of, of the placement of being there all the time, and to see the benefits of being in Pathways to Potential, particularly at Campus Elementary. We have been at Campus Elementary for the last 4 years, and we've serviced probably at least 100 parents within a month or a couple of weeks. Parents coming in and out and making sure those basic needs are met for students to come to school, from food assistance to medical assistance to state emergency assistance such as utility shutoffs, from housing. Homelessness is a big thing that can be one of the barriers for students coming to school. So being placed in the school has really put emphasis on attention to attendance, to make sure that if there's any barriers such as transportation, it can be as simple as an alarm clock or as big as, again, without parents without housing.
Okay, so if I'm understanding you correctly, what you're saying is that a school is an easier place for a family to go to for service rather than going downtown or trying to find transportation to get someplace that is further away. And so in a statewide level, you're reaching out to many communities, but you in particular are housed in one school.
In one school. And a parent could be coming up there to pick their student up to go to the doctor. They could be coming up to meet with a teacher. And this way they're able to just come in and see me, and we're there all year round, and they can get those benefits taken care of. Or they may just want to talk, or I may recognize that their child has an attendance problem, and we can sit down and do an assessment and discuss barriers and come up with a solution to make sure that the parent understands the importance of the student being there.
So both Lorraine and Earnestine, you know those kids. You're very involved with them?
And that's the beauty of being in a school, because you get to know the students, you get to know the families, you get to know the teaching staff, you get to know the principal, because it's all about relationships, building relationship repeatedly over and over again. And in my work with the community partners is assisting the principal and assistant principal in sustaining those relationships as well too. And that's one of the beauties of it, is that you get to see each student individually, you get to see each family individually, and you work from there to identify what will make this student the most successful students. And you try to, as Ms. Young was saying, you have to do this assessment, and you work with the parents, and you look at what is it we can do to help to remove those barriers so the students will be successful at Campus Elementary.
Okay. Well, let's talk about, for a moment, Carol, how does a school actually become part of this program, or how do parents help their school get involved?
So often, when we first started 13 years ago, we did a pilot, and we were in 3 different districts, very much chosen by the highest need. So really looking at economically disadvantaged, where those schools where families are really struggling, students have a high rate of chronic absence, and where's a high English learning community as well, and really kind of going there. And that's how we've grown from the original 8 schools to now 45 schools and 10 school districts. And it also is looking at what's that access. So when you look at Sparta and you look at Cedar Springs, it is tough for people to drive all the way down to Grand Rapids to get services. So a lot of the services that we've been able to place there, families just have to go to the schools. They're not transporting down, or they're not missing appointments, or they really are creating a community up there where services are accessible, which they haven't typically been in the past.
So Lorraine, I got from you just your high energy and your enthusiasm. I mean, I enjoy just that moment of like you being completely you. So I would imagine that if a parent comes in to this facility, I mean, it's not like it's a big bureaucratic, cold and
Not at all.
in an office that you would just be like, oh, how do I fit in here? I mean, I can just see you going, you know, picking up a child even and just giving them a hug.
A lot is like what Miss May says, it's the relationships. And having that atmosphere where it's, you know, non-threatening, it's safe. I mean, the parents come in, there's an area set up that says welcome without a sign. I have toys for, you know, because they can bring their children. They don't have to, you know, schedule an appointment. I mean, they come in the morning. They don't know. When they bring their students in the morning, they'll come down and see Miss Young to bring paperwork, or they may just come in and tell me they got a new job, you know, because with that relationship, they're so proud of accomplishments, and we acknowledge we acknowledge any sort of successes. And I think, you know, to put that recognition of value to parents, it just makes them excel and feel so important as a parent to their student, and they invest in their student while they're in the school.
And I imagine that's important because very often parents are made to feel guilty. You know, like, what have you been doing wrong that your child is not successful? And then I wouldn't imagine that that's a very positive starting point for most parents to try to, you know, feel like less guilt and not certain of what to do to correct a situation. So, Earnestine, I was asking you to think about a student that really exemplifies the kind of work that you do in this position, and what difference did it make?
Well, I'll give a quick example. We had a student who had multiple suspensions because of behavior concerns. And so we all know that when students are not in school, they're not learning. So what we did as a KSSN staff is we became very connected with the parent. And also in terms of referral for resources, because we also have a clinician, a therapist that's in our building, we were able to connect the family with the therapist who specifically works with the students and parents identifying goals, and they work on those goals together. So what we saw was, once the students started working with the therapist and the parent being highly involved with the school, what we saw was a reduction in suspension, to the point that this was a child who was getting suspended repeatedly. But when you wrap those resources around the students and you identify what those specific needs are, then that child has the opportunity to grow, because he's also addressing his own concerns, and he has someone to support him through the clinician. And you also have the parent to come in and be a part of those sessions as well too. And it makes for a wonderful relationship, because there's a collaboration that's going on with not only the family, the service provider, but also the staff, the teaching staff, and the principal. So everyone is doing this wraparound service to make sure that the student has what he or she needs. And that's where our role comes in too, is to ensure that those things happen for our families.
You know, interestingly enough, in terms of the work that they're talking about with families, many adults have had a poor experience in schools. So all of a sudden you have children and they're in schools, and a lot of what the work we're doing is trying to get parents engaged in that, and that's building that relationship to where parents eventually become comfortable in the schools. They then start volunteering. They go on field trips. They become mentors to other students. And the beauty of that is seeing that parent engagement. And a lot of that work really is around building a school where it's welcoming. The culture and the climate welcomes everyone coming into that building. And that's when you really see the buildings and the students thrive, and teachers become, you know, have access to the parents more than they had, principals, and a lot of the work that they're doing, we like to say, really allows teachers to teach and principals to lead. It takes all of that off their plates, where they were finding food, or they were trying to find housing or whatever. Someone else is doing that. So then all of a sudden it frees up them to do what they're there and why they really want to be there.
Right. Well, Lorraine, let me go back to you for a moment. Do you have a sense of how Grand Rapids compares to these other communities statewide when it comes to the kinds of needs that parents bring to your attention?
I'd have to say, particularly, working within Kent County, I don't have an exact measurement of other counties, but after being placed in a school for the last 13 years and seeing the importance of the holistic approach to, in order for a child to be educated, from having the school nurse to having, putting value on the maintenance staff, how they keep a healthy learning environment for our students, to promoting self-sufficiency with our parents, to make them be part of the solutions. There has been an increase in students not missing as much school, because as Carol mentioned too, a lot of our parents have had really poor negative experiences. So we have to build on where they're at, meeting them where they're at, non-judgmental, helping them to identify their strengths and celebrating those strengths. And we celebrate everything.
We do.
And I do mean everything.
A lot of
We do.
excuses for cake.
It is. It is. I mean, if a student came to school 3 times this week opposed to only 1 time, we're going to see that student when he comes in the door, and we're going to, hey, it's so good to see you here, Corey. Or Corey's dad, thank you for bringing him here. He's on time. Just those little things mean a whole lot, and parents build on that, and they look forward to, the next couple of weeks coming in, and they know we're going to be. We see ya, out the window, that type of thing. And,
that's great.
So just seeing the increase, I know, within the schools that we've been in, and the growth of when we initially started, of getting that awareness of attendance out, of that it's a challenge for many of our families. A lot of, we're kind of come from back in the day where, you went to school and that was just it. But now, it's a little different now. Our parents sometimes are real connected to their kids, and there's trust issues. So helping them to build that confidence, and if a parent comes in to see me for whatever reason, and that they got a 3-year-old or 4-year-old, I've got preschool programs, and supporting them of let's start early pre-K, and even putting emphasis on those pre-K parents of getting their students to school.
So let's talk a little more specific about the kinds of services that a school might offer. And are we talking primarily elementary schools at this point? I guess, Carol, that might be more in your alley.
No, of the 45 schools, we're in elementary schools, and some of them are pre-K, so your Great Start Readiness programs for the 4-year-olds. We're in pre-K 8 schools, we're in middle schools, we're in high schools, and alternative
Really?
schools. And then we're in 4 programs at the Kent ISD, so the Kent KCTC, KTC, My School at Kent, and Kent Innovation High. We have 2 folks there that work to support all the students that come through there on a daily basis as well. So spread out across, I think what we found is the earlier you start, so you want to be in those elementary schools, and you're getting those families, and you're really doing some preventive work and building that foundation for school, especially on attendance. If they learn early that they're there to attend, it's a lot easier than a middle or a high school trying to then come back and do some sort of restorative work in terms of getting them to buy into school.
So it's not just then healthcare and that type of thing, it's also social, an exploration of what makes success in, how would you define that?
I think we work around, we provide mental health services and supports through our mental health agencies that partner with us. Department of Human Services, our coordination of resources. There's some school nurses or community health workers, but then where we look, and the beauty of the work of a community school is we bring in partners to help add on to. So if you want to talk about some of your partnerships that have changed schools.
I made a note of that because we cannot do the work that we do successfully without our community partners. And I just have to give them kudos. We have what's called CSLT, and that means Community School Leadership Team. And these are partners that have invested in our school in Campus Elementary School. And once a month, we have a meeting, and when we come around the table, of course we give updates, but it's also a time to work. Again, what is it that our school need? Where can we pull from the resources from our partnership in order to support our students? And we have just a wealth of partnerships, faith-based partnerships. We have neighborhood association. We have insurance companies, Kids Hope, SLD Read, just a number of partners. But the ultimate goal, Deb, what I want to say, and I really need to say this, is that we're addressing the whole child. Mm-hmm. If we don't address the whole child holistically, then again, it goes back to that word we talked about. They're not going to be as successful. Things have changed over the years, so each partners bring their strength. And as we say in KSSN, having the right partners at the table at the right time. Mm-hmm. And that's what we try to do, and that's where my role comes in too, to help the school to maintain and sustain those relationships with our community partners.
Okay, let's talk some details about that.
Mm-hmm.
So when you speak of the holistic child or the holistic approach to learning, how is that different from maybe 20, 30, 50 years ago? And how does that show up with the partners that you have?
Well, 20, 30 years ago, and if you go back to the years when I was in elementary school, it was more of you come to school to learn and that's it. You know, you didn't have the support. And sometimes nowadays I think there's generational changes, and where we have to explore what are those generational changes as well too. So meeting the child where they're at, and meeting the family where they're at holistically, it is about looking at emotional needs. It's about looking at mental health needs. It's about looking at academic needs. It's about enrichment. You know, it is about, do we have programs available for kids to participate in sports? All of those things are critical to supporting the whole child, and each one has its own entity and developing a successful human being as well too. So I don't know if Carol and Ms. Young can also expound on that question.
I think you did a pretty good job.
Yeah, I think you did a great
Yes.
job. Well, one of the things I want to go a little further with, though, is because it sounds like a lot of this is those community resources that you're tapping are coming to the table voluntarily. They want to be there.
Yeah.
But there are a number of issues in terms of funding that, of course, put you in the situation in the first place. And I would say that schools have enormous challenges. So Carol, let me ask you to talk a little bit about funding resources that support the efforts that you see people voluntarily contributing to the district. Where do you see your resource issues?
So I think, first of all, we're a nonprofit. Our 3 community mental health agencies are nonprofits, and then a state agency. And so state agency comes with the state resources. The rest of us are raising money on our own. Schools have skin in the game. 62% of our funding comes from schools, another 18% from Kent County. And then the rest come from local foundations, where small family foundation that may give $5,000 to a school where their mother was a tutor. And or a larger community, Grand Rapids Community Foundation has been one of our largest donors to date as well. And they see that investment, that they're investing in this community school strategy. They see students are attending, and with our ultimate goal is students go on and they're healthy, they're graduating from school, going on to their career, to college, whatever it might be, and families are becoming better supported, and I think that's the beauty of it. But the other piece of it is, as Ernestine's been talking about, is that when you have these schools, last year we leveraged about $650,000 additionally from our community partners that came back into those 45 schools. So community partners are a big part of that. United Way, their Stuff the Bus, brought $100,000 into the KSSN schools for school supplies, and so that's another piece where where we have the funders that are funding the work that's going on with the staff, but then in terms of looking at what's happening in those schools, there's a lot of community reinvestment there with volunteers and mentors, and then food for over the snow days, and it just has really been the beauty of it is, and where you see the partnerships thrive is when schools are open about the data. Boy, we've got a real issue with chronic absence. How can you help me? They want to be there. Or we have a real issue. We don't have any coats and boots. And you know, so whatever it might be. And so schools are vulnerable in that they're sharing some of the challenges that they have. But then when you invest as a community partner, you're saying we're here to walk alongside you. We're here to make sure that all these beautiful students in these schools are as successful as they can be.
Can I give an example?
Yeah, absolutely.
We have, and it's just, Carol made me thought of this. At campus, we have what's called the walk-in school bus, and that's a national program. So, and basically, the walk-in school bus is what we did back years ago. It's a walk-in school bus. Usually, someone leads the school bus. So we have an example is one of our parents, a couple of our parents decided that I'm going to step up and I'm going to be the walk-in school bus leader. And what that does is that supports attendance. Because you would think of, will that student have been late getting to school had not this parent say, I will walk from house to house and pick up these students and make sure that they get to school on time every day. And that's the beauty of the relationship with parents as well too. It's just a wonderful thing for me to be a community school coordinator. And I always say, out of all the jobs that I've had over the million years, this job is the top one for me. And it will be the top one until I retire. Because
despite the challenge.
Despite the challenge, because, and I can still smile. I have yes in the heart, and that's something that you have to have. You have to have yes, and you have to believe that no matter where these students are coming from, whatever their circumstances, past, present, they have the ability to be as successful as someone who's in an affluent neighborhood. And that's my belief.
And it sounds like you've certainly seen lots of evidence.
Yes.
Well, I wanted to ask Carol one last thing about funding. What would be your hope and dream that the legislature would do to support these kinds of programs? Because when I hear you talk about the volunteers and the contributions and going to foundations, I mean, if any of that fell out of your program, it sounds like you'd be in great jeopardy. And so what could be done to ensure that the programs continue?
Well, I think first of all, it'd be great if Michigan's funding kept up with the rest of the states. The MSU study that just came out saying we're dead last in terms of how we're funding, our schools. So I think there's a critical part of first of all, funding for schools. But I think the other piece is where what we found across the country is that community schools now are about 7,500 strong. We have 146 community schools in the state of Michigan, and along we've got the pathway schools that are very much a part of the work we're doing as well. And are there opportunities for state funding to fund some of these positions? And so we're looking at that, but I think the other piece is knowing that systems are funded well. So our mental health system is funded well to be able to provide the services and supports for children and families. Our education systems are funded well, and then really looking at where are the opportunities for jobs for families. So there's housing, and I think when you open up a community school, it's not just that building, it really is all the systems within your community, and to make sure that they're all funded and that people have an appreciation that we can't do it alone, that we have to do it with everyone.
Absolutely. Well, I've certainly heard that loud and clear. Is there anything else you'd like to add that I have not asked you about? Because having three of you here, I wanted to make sure we had a broad perspective, but I'm sure we only began to scratch the surface.
Excuse me, I have to say, initially when we started, we were at a middle school, and now those students they're adults. And I've had the opportunity to go through a McDonald's and see a student that was a previous middle school student that's employed, and I asked him through the drive-in, you're there every day, right? You're on time. Because it starts there. And it's so, to see the seed planting to be able to be part of the harvest and to know there's still work to be done. And long after when I leave, you tell the kids buy into it. Yeah. They hold their parents accountable. And parents are taking ownership of, stepping up the game and making sure their students are there and that they're part of their child's engagement and involvement in the school, whether they're in the school or they're communicating with the school via phone. But to be part of the harvest I'll tell you, it's priceless. And I'm counting on those kids. I know they're coming through. So
Well, we're going to need them.
I'm counting on them. I know they will.
Well, I want to thank you so much for being here.
Well, thank you.
It's an enormously important service, obviously, and like I said, it's been really fun. I can imagine going into a building and seeing any one of you and just feeling like it was home. So I
It
thank you
feels
so
like
much
home. Yep.
for providing that. That's just wonderful. And I want to wrap up here by saying, you know, in the long run, our workforce and our personal safety, our society, we all depend on healthy, capable, intelligent children, and that requires healthy families. And those of us lucky through birth or circumstance, we have the opportunity to pay that good fortune forward. And our next generation deserves that, and we need to have reality be closer to our reputation here in Kent County, which is that it's a great place to raise a family. So let's make that real.
Yep.
And that's it for Kent County Close-Up. Thanks for joining us with the production team here at GRTV. See you next time.
Thank you for having us.
Ooh, thanks, Deb.